It's the show the establishment warned you about.
And thank you for joining us today. This is Dr. Tommy Show live from Wesley Chapel, Florida. I am your America's Free Market Doctor, Dr. Tommy McElroy, and this is Tracy.
Hello.
They cheered louder when you came on. And we are proud to use Atlas MD at our Concierge Medicine practice, which is a preeminent medical software for membership medicine practices. If you want to learn more about Atlas MD and you're a physician, or if you're not a physician, go to atlas.md and click on special offer for Atlas MD, or go to askdrtommy.com, click on special offer for Atlas MD. And if you're a doctor, you can get it free for 60 days and try it out, and you'll see all the different features it has, including billing, including messaging, including prescriptions, including sending prescriptions, and it's also a way to do notes. Mm-hmm. And it's also available across all platforms, including your phone, your iPad, your computer. And so, like when you're at the Busch Gardens waiting in line and the patient texts you and said they need a refill, you can just go ahead and send it before you get on the ride, like I did before. Yeah,
that was good for that patient. It worked out well.
We're going to cover a little bit of hodgepodge today. We didn't have really time to do a lot of show prep because there was a busy morning, but I was going to talk a little bit about sleep, a little bit about prices of healthcare and health insurance, and then cover a little bit about the media and culture and how it is pervasive today in today's environment.
Are we going to talk about a recipe also? Did you?
And we'll talk about oven fried chicken.
Yes, and you took a picture, I think.
I did, but I can't load it up.
Oh.
I have to. Maybe we'll do that next week.
Okay.
And so the first thing I want to talk about is the importance of sleep. Sleep is one of the things that we neglect oftentimes because we do not feel like sleep is as important as getting more work done, as getting up early, as watching your favorite show. And in the short term, you may be able to get by with that, but in the long term, you can suffer health consequences from that. And one of the things that we encounter most here that people are concerned about is hormones. Mm-hmm. People want to know if their hormones are okay, especially their testosterone, men and women. And sleep actually has an important role in regulating your homeostasis, which basically makes sure that all of your regulatory mechanisms of your body are in order. And if you think of your hormones are like an orchestra, and they all play together. It sounds great. When one of them's off, just one, it can screw up your whole day or screw up your whole health. And think of sleep as being important as having a good conductor. And so if you don't have a good conductor, you don't have good sleep, you're going to have all these different hormones playing at different levels and maybe not getting a good sound. One of the things that we talked about on the show with Dr. Hoffman is the importance of sleep for brain function. And one of the things that sleep does is it helps to trim your neurons. Now, you don't like having dreams when you sleep.
I don't, because I feel like when I wake up in the morning and I can recall my dreams, I feel like my sleep has been interrupted.
And that's interesting that you say that because when you're having sleep and it's interrupted, and I think I haven't read this exactly, but I believe if I remember correctly, when you're sleeping, the REM sleep is when you're having dreams. Is that correct? I think so.
So when I'm having dreams, we're in REM.
I think so. During REM sleep, activation of areas different to the wake state occurs, such as activation of the amygdala and medial prefrontal areas, fear circuitry, hence anxious dreams. The atonia during REM prevents skeletal muscle activity, that is, preventing the acting out of dreams. And so I'm reading from Brain Beat by Dr. Michael Hoffman, and this is a book that was given to me when Dr. Hoffman did our brain health podcast. And if you want to see that, go to askdrtommy.com, or actually go to Dr. Tommy Show on YouTube and then click on the playlist that is Healthy Hearts and Minds, and you can see Dr. Hoffman. But anyway, this is Dr. Hoffman's book he wrote. It's a thick book. And I just wanted to read something about this called topiary. So topiary, if you're familiar with pruning, is kind of cutting plants, right? Mm-hmm. And so what's the reason that we do that on a plant?
Well, so it can grow, come back, grow healthy, grow taller, wider. Flowers are going to bloom on it more often, more frequently.
And so a similar thing happens with your brain. So according to Dr. Hoffman's book on page 277 in Brain Beat, it says, sleep has restorative functions that involve the removal of neurotoxic compounds that accumulate with cerebral activity during the waking state. Experiments in mice, real-time tetramethylamino diffusion, and 2-photon imaging revealed a 60% increase in the interstitial space during natural sleep that facilitated exchange of interstitial fluid and cerebral spinal fluid. That has the effect of flushing out metabolic waste, termed lymphatics. And so Dr. Hoffman also talked about in the podcast the neuronal pruning. So during your day, you're making these neuronal connections. So every time you do something, just about you're making a connection in your mind. And we make far more connections during the day than we actually need. And when you do that, you can clog your brain. So you'll walk around with
brain fog.
Brain fog.
I have brain fog all the time.
Which makes sense, though, because if you think about it, if you get a nice restorative sleep, you wake up and you feel refreshed, not only physically but mentally. And so it's a good book. If you're interested, you can go to, I think it's on Amazon, but I think we have a link for it on the YouTube video for Brain Beat, and or go to Dr. Hoffman's website, and talk about it in our podcast. Just watch the podcast and you'll get more information about it. So that's something I want to cover.
It was a very interesting podcast. I really need 9 hours of sleep. I mean, I really feel like I feel the best if I can get 9 hours of sleep. I know you can run on a lot less.
I can run on a lot less, but is it effective? That's a question. So, a lot of times when you're, like I said, you do things you do other things that you think are more important, and then at the end of the day, you think you accomplished more because you're up longer, but maybe you didn't do as much because you
didn't do it as well.
Yeah, you weren't as good. You weren't optimally performing. I also wanted to talk about the healthcare. So, this past week we had the Graham-Cassidy bill, which was the latest attempt to repeal Obamacare, and it failed. And it failed for a number of reasons. Some on the, I guess you call it, non-Obamacare side failed because they didn't think it went far enough. And then those who are for Obamacare, pro-Obamacare, it failed because they didn't want anything that touched the Obamacare current ACA regulations. And so I think to hear it from a doctor, you should try to see it from the way we see, at least people like myself, you. What is the ACA done? What has the ACA done to improve the overall health? And so in order to answer that question, I think you got to step back and say, what has the ACA done that's positive?
Let me see. Well, for some people, it has given them the opportunity to have insurance at a reasonable rate, or very, very low rate.
Some for free.
Some for free.
Okay.
So that is a positive note. And and there are some people, and there are some people that are temporarily on having a hard financial hardships. And then there's other people that,
Well, the reason for the ACA was the Affordable Care Act was to provide affordable insurance for everybody.
That's right.
And also the great uninsured.
Yes.
The great mass of uninsured. Now, of those people that are uninsured, most of them were young, healthy people who did not want insurance. And they are also people who could not afford insurance, even at those rates that they were before. So that's what the reason for the ACA was on its face. What the ACA has become, though, is this extremely valuable legislation for healthcare industry. Someone posted something on LinkedIn the other day that shows that there's two sectors in the economy which have gone up in cost while other things have gone down. And they didn't list everything, but they listed technology. That's gone down dramatically. So the cost of a TV nowadays is minuscule compared to what it used to be. So technology has gone down. What has gone up? Well, healthcare is at the top of this graph. So healthcare has gone up. The price per unit of healthcare has gone up. The price per unit of education has also gone up. And someone posted a question. It was actually Dutch Rojas, I think it was, posted this. Or maybe it was somebody else. I can't remember. Somebody on LinkedIn posted it. Maybe Dutch commented. I can't remember. But anyway, it said, so what is the correlation between these? What is the reasoning? And to me, the reasoning is the government. Because both of those things are areas where the government is highly involved. So the delivery of mail is another one that probably has gone up too. They didn't show that. So government is involved in the cost of healthcare and also in education. So government, by and large, produces education in this country, funds and produces it. So there's some private education. So there's some private education that's done, but mostly it's by and large produced and funded by the government. And so what we see with that is not necessarily efficiency. So the government has never been known to be efficient. Even those who say that the government is fair will oftentimes admit that they're not efficient, or if they go to their local Social Security office or post office, they will see it's not efficient. And that's not necessarily a fault of the people who work there. Certainly there's people that work there who are very diligent. Some aren't. But the reason for it is largely because just that's the way of government. Government is not efficient. And if you look at the cost of medical care and you correlate it with education, both of those things are things that the government's highly involved in. And it's all for the benefit of being fair.
Right.
But who's not benefited from the ACA?
Well, the majority of our patients, or maybe even all of them.
Why?
Yeah, the price is ridiculous.
But why is that? Why have they not benefited?
Well, because we have the people that it's benefited, which, they pay nothing or pay very little. So the other patients that work hard for a living, business owners, they're helping pay so other people can have free health insurance.
Right. So,
but those people, you think they realize that?
The people who are getting subsidies?
Yeah. What do you think they think about that? I
don't know. That's a good question.
The patient 2 weeks ago that told me she pays $2,000 a month for her and her husband and her child. What does the person think that is paying $20 a month?
I think they think that they're getting a deal, and the government's paying for the deal. But as Walter Williams has pointed out, the government doesn't have a job. And the government can only get money to give to one American that it takes from one other American. So I think so why is all the reason for all this talking? Is it to slam people who are getting subsidies? No. The reason for all this is to talk about what is the reason for health insurance. So let's get back to the basics of what is health insurance for? Okay, what should health insurance be for?
Well, I think that health insurance should be for when you go to the hospital and you have a true medical emergency.
Okay. So like
a heart attack.
Or you get
surgery.
Broken arm maybe.
Yes. Something serious.
Okay. So what is health insurance used for now?
Everything.
Everything. Under the sun.
Everything.
And that is when you hear people say, I have good insurance.
Yes.
I have good insurance because I don't pay when I go to the doctor, or I pay a copay, and everything else is covered. But what's done on the back end is what they don't understand, or which they understand they don't care, is that the premiums are very high for some people.
Right. You'll hear people say that, my insurance pays for everything, I never pay a dime. But then I'm like, well, how much do you pay a month? And they pay a super high fee. And then think about that though.
Well, think about this as well. Some people don't. Some people don't pay a high premium because their company pays for it. So if you and I were a business, we're Echelon Health, let's say we're going to hire somebody. And let's say we decide that we're going to hire somebody and we're going to pay them a salary. Okay. And we're also going to give them health benefits. Okay. Would the health benefit cost factor into how much we pay them?
Yes.
Why?
It would. Well, but we have to think about the fact that we're going to have to pay at least 50% or maybe more towards their health insurance. Then let's say they pay 50%. So we might have to pay them less to cover it, right?
So they're paying for themselves, really, by their work, but they're not getting paid in wages, they're getting paid in benefits.
Right.
And so that's the other thing. So all of this is to show that health insurance isn't about people seeing the doctor. The reason for health insurance is to employ people who work in the health insurance industry and to pay doctors and to employ everyone else who's associated with the health insurance industry. And that is not going to go away. That has been built and built and built and built many, many decades, starting in the 40s with when there was wage controls placed on wages, and employers had to offer people benefits in order to encourage them to take a job. And so that was the beginning of it. And since then it has grown into this just this Medusa head of all these tentacles into different things. So now you have an enormous amount of people who are paid just to perform the functions of letting people see the doctor with their health insurance.
Right. Yeah,
which is what we don't do here. So we can clearly see. But I think a lot of people out there listening don't realize all the different nuances of what is health insurance.
No, they don't. Okay, so at the end of the year, most employees are going to get a summary of how much they paid in for that year to insurance.
Right.
Okay, so and a lot of times it just comes right out of their paycheck, so they don't see it.
Yeah, it's maybe $1,000, couple grand, maybe.
Yeah, couple grand, and then you're also going to see how much your employer contributed, and it's going to be equal amount for sure, and most likely more. And then so you think about that. Let's just say you paid $2,000, they paid $3,000, so that's $5,000 extra. I mean, a year. And the patient has to, and then that person has to think, well, gosh, how many times did I go to the doctor?
Right.
I paid all that money and I went to the doctor one time, if even that, because there's so many people that never see a doctor. And they could have had that money in their paycheck instead.
So what's the solution for it?
I don't know. God, I don't know.
I think the solution
back to the old days, where...
Well, but what about all those people that work in these industries? They're not going to want to give up their jobs. Benefits managers make a living helping companies figure out what type of insurance plan to buy.
Yes, they do.
So are they going to want to? So it's the same with the IRS.
I know that a lot of people, yes, they do. They're protecting their job, of course, protecting themselves. So just like,
is it for the greater good though? So is it? And the other thing is, what if it's not for the greater good? So what? Let's talk pure economics. Let's say we're going to operate under a free market. So back in the early, let's say, I don't know when the Model T was made, but early 19th century. Or early 20th century, early 1900s, horse and buggy was going out of fashion, okay? And they were starting to use more cars. And so there was probably a whole bunch of people who jobs were dependent on horse and buggy. I can think of a number. People who probably trained horses to drive buggies, people who made the halters that went around the horses, people who made the buggy whips, people who made the horse buggies themselves. And so if you were to transplant that technology now into this century and then say, okay, now what are we going to do with these people? I think there would be politicians right now saying, look, we cannot get rid of the horse and buggy. We have something that's more efficient, a car, but we cannot get rid of the horse and buggy because we have so much money tied up into the horse and buggies. And so the real answer is this: we have to be honest with ourselves about what is important in your country. It's your country. And so is it important to have people employed to do things that are not necessary? And there is a lot of people who are in jobs that aren't necessary. Not necessary meaning they're not adding to the equation. They're not adding to the importance of. And so you'll say, well, then they can't have a job. Well, there's always jobs that people can do. It's not saying that they are not good. Their job maybe isn't necessary. I used to give the analogy of I think there should be a mandated health care hall walker.
A health care
hall walker. This would be a stimulus program. And every doctor's office in the United States, while they're open, should have a hall walker.
What is that exactly?
So what was a healthcare hall walker? He's federally trained, federally certified to walk the halls of your medical facility. And what he'll do is he'll start the day as soon as the first patient comes back, he has to start walking, he or she, and they walk the halls. And they walk the halls and they do a necessary function because the government has passed a law saying this guy or gal is necessary. And what they're going to do is they're going to look for things. They're going to look for like HIPAA violations, let's say. And so that's a way that you can introduce unnecessary cost into the whole healthcare system. So my solution for it is go back to say, well, what is important? Are there people working at insurance companies or benefits managers who could be doing something more productive versus billing codes, versus denying care for one digit being off on your ICD-9 or CPT code? And so there's an analogy called the broken window fallacy. So it goes like this. There's a town of a village, and it's got a shop owner, and he sells coats. And then there's also a glass manufacturer. And then overnight, someone has thrown a rock through the window of the shop owner and stolen a coat. Once people are getting out there, they're gathering around, and they're like, oh, this is awful. He's such a nice guy, and someone broke the window and stole a coat. And then one of the people gathered around says, well, it's not such a bad thing. And then he goes, well, I don't understand what you're saying. He goes, well, Now, this shop owner has to buy another coat to replace that one. Mm-hmm. That's going to put money in the pocket of the guy who sells fur, and he's going to have to pay the glass manufacturer to put up a whole new window. So you can actually say this actually helped.
Everyone won.
And that's called the broken window fallacy, and everyone didn't win because the money that person spent on replacing that fur coat that was stolen and replacing that glass could have been spent on other things, like hiring someone to work in a shop. Mm-hmm. So all the money that we spend on healthcare can be put to good use. And the people who are employed potentially can be employed in a good use. Mm-hmm. But having people employed just to deny people care, to check CPT codes, ICD-9 codes, that is not going to be an effective way to provide medical care to people going into the next century, going forward.
I wish there were more options out there for self-pay or cash paying, but there's just not. I've been on the telephone all morning, trying to find cash paying facilities.
Yeah.
And it's almost impossible.
Well, then we start talking about the cartel. Mm-hmm. So what is the cartel? So the cartel is the group of people who are opposed to a way out. So we're talking about a way out. We're talking about a peaceful way out. I'm not saying that everybody who works in this industry that I think is inefficient should be fired and made to stand in the soup line. No, I'm talking about a peaceful transition. But the cartel does not want that. Mm-hmm. So what does a cartel want? They seek to exclude options, to increase or maintain opacity, and to use emotion to say, look, if you oppose Affordable Care Act, then you clearly hate poor people. Mm-hmm. You do not want people to have doctor care. You are for the rich only, and you are basically a piece of garbage. And that is how the cartel operates to maintain the status quo. And that's a kind of cynical approach to look at it. But if you look at it, if you get down to the nuts and bolts, that's what goes on in the back halls of Washington. How do I know that? Well, I can say it's a guess or it's a feeling that I have. But there's also a thing, if you go on to Twitter, the AAPS over the weekend posted something, and it was a update to the Graham Cassidy bill. So we have the health savings accounts, right? You know what health savings accounts are? We all know what health savings accounts are. So for those of you out there who do not know, health savings accounts are a way that you can save money pre-tax out of your paycheck and use it to pay for medical care. So you can use it to pay for doctor visits. Mm-hmm. Except here, one of our patients couldn't pay it here because their HSA administrator or whoever said that you have to see a real doctor.
Yeah, and we're not real. We're not a real facility. Doctors. You're not a real physician.
But anyway, so there was legislation in the Graham Cassidy bill to say people should be allowed to use their health savings account to pay for insurance premiums, which is currently outlawed, and direct primary care.
Yes, but not.
But what happened was that was amended.
That's right. They changed it. Right?
It was amended, and it was amended to say the following: health savings accounts dollars can be used to pay for
insurance
premiums. But the part about direct primary care was stricken. Now,
why do you think that is?
Well, why do you think that is?
It's okay to pay insurance companies.
Right.
But it's not okay to pay doctors directly. And
that's what I call the cartel. Mm-hmm. That's the nefarious way that moves about in an anti-competitive environment to restrict access for physicians, to restrict access to physicians, and to restrict the access for patients, to restrict them from having options. Mm-hmm. And people say, well, you're anti-insurance, blah, blah, blah. Bull. I can tell you for a fact that insurance performs a very necessary function. It goes back probably to the early Roman period or Greeks. But the insurance that we use today is not insurance. Insurance should be used for things that are rare, in my opinion, rare, expensive, and unpredictable. Mm-hmm. If you have a health insurance plan nowadays, chances are you have insurance component, but you also have a prepaid health plan. And I think back to what our point was, is what should be done. People should be allowed to buy health insurance only and not be forced to buy prepaid health plans. Mm-hmm. Now, if people want to buy prepaid health plans, then they should be allowed to. If you want to buy an insurance policy, quote unquote, that includes a certain level of benefits, let's say it includes you to go to the doctor for $20 or $40, $50, includes you to go to emergency room, includes you to only have to pay so much. That should be your choice. You should also be allowed to buy an insurance policy that says, look, I just want things covered above $25,000 or above $5,000. I want to pay for the first $5,000, and I don't care about paying the doctor. I'm going to find a DPC doctor, a concierge medicine doctor. I'm going to go to a walk-in clinic. I don't care about drugs because I'm going to use the $4 Walmart list. I don't care about, I don't care about dentures because I'm young. I don't care about GYN care because I'm a man. I don't care about prostate care because I'm a woman. And then leave it at that. That's what should be allowed. And that is part of what's the ongoing effort. So that's all the whole reason we do all this. Education. People should be allowed to have their choice to understand what their options are and be exposed to their options and not be shouted down as anti-poor, anti-whatever, just because you do not agree with what the media and the establishment has said is necessary to provide medical care to the masses. And I can tell you there are more people now who are having a harder time seeing a doctor because of the Affordable Care Act than before. And if we really, 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 really wanted to pay for all the poor people to see doctors, we could do that so easily. On a state-by-state basis. Each state could easily take care of every poor person in their community. But what would have to happen is some people that are out there making money off this current situation are going to have to find other employment. People who are making money by maintaining an expensive health insurance bureaucracy, health care bureaucracy, are going to have to find new employment. And they're not going to want to do that. So that's where we're at. What else we're going to talk about?
We decided to scratch the recipe.
Yeah. We're also going to talk about, I wanted to talk about the national anthem.
Oh, okay.
So we have it over the weekend. There's been not over the weekend, over the past week, there's been a lot of controversy about the national anthem. And never did I think I would live in the day when the national anthem was controversial. But now here we have the national anthem being controversial. And so basically, last year, Colin Kaepernick started kneeling for the national anthem to protest police, I believe.
Oh, was it?
I think that's what the reason was. So police misconduct in his opinion. And so he kneeled for the national anthem. Caused a great deal of controversy. And so this year, more people started kneeling. The National Football League just started back up. And now it's become a national thing because the president actually weighed in on it and said that the players should be fired. And so now there's an uproar about that.
And he did call them a name. What did he call them?
He said that, he said son of a.
Yes.
He said he wished the owner. He said he wishes the owner would say those SOBs are fired. So that's caused a national uproar. And so get back to the point of it though. What are we protesting? We're protesting the national anthem. I believe that in this country that everyone should have the right to protest peacefully whatever they want. And I believe that employers should have the right to do whatever they want in their employee handbook within reason from basic rights. And so I think part of it is both sides are right. And I hate always when people go down the middle and because there's a weasel way out. But the truth is yes, do these players have the right to kneel before the national anthem? Absolutely. And does the owners have the right to fire them or promote them? Absolutely. And do I care? Not a damn bit. I can tell you these people have no influence on my life at all. And I don't understand. I guess I can't relate to it, but how, and I guess it's because of my general inclination anyway, is how people, the opinions of especially media people or presidents or anybody influence their daily life.
I know people are so offended by, we already know that people walk around, they're angry every day.
Back to our brain health. That can't be good for your brain.
It cannot be good. But as people are going crazy over this, these guys kneeling, I don't care because I just don't care anyway. Would I stand to attention, with my hand over my heart? Yes, I would for the national anthem. And I want both my daughters to do that. But if these men choose not to do it, these men aren't even important to me anyhow. I don't care. They do not affect my life.
And it's the NFL. It's anything though. Media in general. I think media's got a very interested in constantly stirring things up. If it's not hurricanes, or lack of attention to hurricanes, if it's not statues.
Are you talking about Dennis Phillips?
No, I'm not talking about Dennis Phillips. Okay. I'm talking about the media complex. If it's always something, the media has always got to have the American people triggered. I've always thought, and I've said, I don't watch it, but if Americans could just take a break from the media.
Yes.
Now, the media controls a lot of stuff, though. They have a lot of money. So when we talk about the media, who are in general? Well, corporations like Disney, like Comcast, like all these people make money off of revenue, off of advertising. And eyeballs equal dollars. And so there's this constant need to have them look at me. It's like, look at me, look at me, look at me. Look what I've done. Look what I've done. Look what they've done. And that's how they generate money.
Yes, if the
media,
and
they use people to generate their own.
Yes, if the media right now would lay off,
but they have no intention of doing that.
They're not going to, no, because it gets them ratings. But if they would just stop reporting about it, it would go away. Well,
too, though,
these men would just be kneeling on the field, and everybody would go about their day anyway.
If people would just stop paying attention completely, I can tell you what, if I was the president, I would never even, what I would have done from day one. Granted, the media hates the president, right? Because he's on the wrong side. Media loves one side, hates the other side, generally speaking. He's on the wrong side. I would have even paid attention. I would just work towards whatever my goals were. And because if someone comes to you, let's say you're in a fight with somebody, and they come to you and they're running their mouth at you, and you run your mouth back, and they run their mouth and you run your mouth back. It's just going to keep going.
Right. It doesn't get anywhere.
Now, if someone ever, this happens at football games sometimes. These people come up, Florida State fans, Tennessee fans, Georgia fans, all these fans come to a Florida game, yelling at your face and everything. I never say anything. And if you keep going back and forth, they're going to keep at you. But you just stop, and then they look like idiots. They're sitting there screaming. And you're just sitting there and they look like a moron.
Yeah, and I made a comment yesterday. Look, there's so many people that's angry about these NFL players kneeling. I could care less. But all these, like I was saying yesterday, if these people put that much devotion into what they're paying for health care.
Yes.
And who cares about the NFL? Put that much attention into the fact that you're paying crazy premiums.
But back to our earlier point, a lot of people aren't paying crazy premiums.
Yes, but there are a lot of people that are.
There are a lot of people who are. But maybe they didn't know why. There are a lot of people that don't understand insurance at all.
I know.
So that's part of what we do here. Try to educate. Leave it there. Hey, that's for you.
Most patients
take it as you wish. Think about it, but be informed.
A lot of people they'll say, what's the name of my insurance company? They don't even know the name of their insurance company. Well, it's kind of like people don't know how much money they pay in taxes. How much do you make? Well, they'll tell you their net pay. Well, their net pay isn't their pay. Net pay is part that you're allowed to keep after the government takes their end. Let's just say you have $100, $150. Most people have a lot more than that come out. But then, you ask them, well, where's that money going? They don't even know. They pull out their pay stub again. They're like, okay. Yeah. I don't know where it's going. Yeah, wait, they're putting some of that into a savings account for you. Social
Security. So how many people know that 15.2% of their income is taken off the top?
Not enough people.
15.2% of everyone who works, if you work as an employee, of your income is taken off the top. And you pay half of that, and your employer pays half. And some people say, well, see, I'm not paying for that because my employer is. Well, back to our point about health insurance. If I have X amount of dollars to spend on an employee, and they come in and they say, look, I want to work, I'm going to say, okay, I have this amount of money to spend on you. If I have to pay 7.5% to the government for you, for some type of fictitious account, be it Social Security or Medicare, that you're supposed to have when you retire, which is not going to be there, am I going to just say, well, I'm not going to count down, I'm going to pay you more? No, that comes off the top. So 15.2% of your income is gone. Then you pay federal taxes, but some people don't. So that's part of what the ACA was about too. Is I think it was I can't remember which one of the senators said, "Look, this is about redistribution, and that's what it's about." And redistribution is a fancy term for saying, "Look, there's a certain amount of money in the United States. The people who believe in redistribution of income believe that all the money was there at one point." Let's say at the end of the year, at the beginning of time. Then a bunch of people got there and took more than their fair share. Okay? Some people only got a little bit, some people got a lot, and mostly it's got to do with reasons of favoritism, political connections, racism, bigotry, homophobia, whatever. And so people got more than their fair share. So these politicians are going to come around, and they're going to redistribute it. So they say, look, poor people don't have enough income. There's only a certain amount of income. We're going to take some money from you and give to you. So that's how you redistribute it through insurance. You do it through subsidies. That is called the zero-sum game. And the zero-sum game does not exist in a society that has free markets. So the pie is not fixed. The pie can grow. And so you may have 1%. Or you may have 10%. But if the pie grows, you're going to have more than 1% because your 1% means more. Mm-hmm. But redistributionists don't believe that, or they proclaim not to be it. But no, there's a lot of stuff going on that is subtle. That a lot of the things you say, well, that's just about the national anthem. That's not about anything else. Mm-hmm. But there's a lot of nuance to your daily life that if you watch the media, they're going to just try to goad you into voting a certain way without even thinking. Yeah, I think a lot of people will probably vote for the ACA tomorrow if they had a chance. Let's say it was a popular vote, just out of fairness, thinking that the ACA is fair.
Yeah, the ACA is people. You really have to educate yourself.
ACA is not fair to a lot of people.
It's not, no.
And it's not fair to it's immoral, in my opinion, to restrict doctors' ability to see patients based on the whims of elected bureaucracy in Washington, D.C. And with that, we will close. For all of you out there listening, if you'd like to learn more about the Dr. Tommy Show, go to AskDrTommy.com. Click on the listen link for listening online, or you can watch on YouTube. And for those of you listening online, you won't be able to hear this because it's going to be the Black Keys' Sinister Kid, which is a album. I think it came off of their brother's album, or maybe it was off. I can't remember what album it was. Anyway, it's the Black Keys' Sinister Kid. And if you want to,
from the Brothers.
Oh, it's from Brothers. Okay. Mm-hmm. And if you want to learn more about what we do, go to TampaDirectCare.com, learn about Echelon Health, or go to AskDrTommy.com, and we'll see you next week. Bye-bye.
Are out and the streets are gray. You know I wouldn't have it any other way. Yeah, your mother's words, they're ringing still. But your mother don't pay our bills. Yeah, a sinister kid is a kid who runs to meet his maker. A drop dead spread from the day he's born, straight into his maker's arms. And that's me, the boy with the broken halo. That's me, the devil won't let me be. I got a tortured mind, and my blade is sharp. A bad combination in the dark. If I kill a man in the first degree,